Thank you, Sman. Of course, he's the intellect part of the talk, and here I am to talk about non-intellect, easy part. So I get the easy job, he did the difficult part. So of course, we've learned so far what the virus is, how it presents, things like that. Now my job is going to be, how do we know we have it, and we'll go on from there. So next slide, please. So far, how do we diagnose coronavirus? At this point in time, we're using a technique called nasal and oropharyngeal swab. If you look at the picture here, they take a swab, they go up your nose, they take some they just scrub the inside of the nose wall, and they also do the same procedure through your mouth as well. So that's the most common method. Other is we ask you to bring your sputum, so they do that, and then all these tests right now are getting performed at state level at the CDC department. Of course, as we all know, it's changing, evolving so rapidly. They're trying to have more and more places do it. So as time goes by, maybe by Monday, Tuesday, we'll have more centers, but that's the procedure of diagnosing the test. Next slide. So once it's diagnosed, how do we treat? So I will say, you see this in bold here, the best treatment so far is self-quarantine. That is the treatment at this point in time of the virus itself. Of course, it can have complications that will be dealt differently, but the COVID-19, the treatment is self-quarantine. People ask us, what's Tamiflu? We have no idea if so far, it's not effective. Kaletra, other medicine, it might shorten the course, but is not indicated, and so, again, treatment is self-quarantine. Next slide. So, that is the biggest thing that as physicians, we hear this and we understand, I would be concerned as myself, that what if I'm infected? So, problem with this virus, it presents like any other flu-like illness, so there's no one symptom that will say you have COVID-19. So, typical symptoms are, as was mentioned earlier, fever, cough, malaise. Just imagine it's seen in everywhere. So we really cannot test at this point in time if you have these three symptoms. So as of today until 4 p.m., the recommendation was, if you have these three symptoms, you're just going to stay home, try to limit contact with someone else, and you hope it wasn't COVID-19, which probably most likely it won't be, and it'll pass. Exception to the rule here is this, that unless you have high-risk exposure, you went to China, Iran, Italy, or you've been exposed to a true COVID-19 person, that's when you pick up the phone, you call your primary care doctor. We have instructions at that point in time. There's a hotline. All of us are calling the hotline. Even physicians are told to call this number. From there, when you call this number, they fax us a form, we provide information, then they give us directions where you need to go. So that's one. Other case scenario is this: if you have high-grade fever for a few days and you're short of breath, that's when you go to emergency room. That's a recommendation at this point in time. Again, I said earlier, it's changing, but so far this was true about until this afternoon. Next slide, please. So other thing is, what if my family member has it? These are things that are common scenario. It can happen to anybody. At this time, like 2 weeks ago, we didn't think much about it because, we weren't too sure. Now it's hitting home. So what if my family member has it? The best way is really, you should make sure there's no contact. So the household members should stay in other rooms. We shouldn't allow visitors. Hand hygiene frequently. I'll come to that in a second. Mask for the patient. We need to make sure we wipe all the high-touch surfaces frequently using alcohol-based wipes. Next slide. I think it's a maximum. So remember when I said self-quarantine? Really, so this all pertains to that. So what we do is this. It's really all common sense thing that we all need to do and we can do. We need to stay in a room. We are not going to share personal items. And we need to wear a mask. If you are suspected and you're in quarantine, you need to be in isolation. Personal items, glass, utensils, we shouldn't be sharing, and we need to put on a mask ourselves. I touched on hand washing. So recommendation is with soap and water for 20 seconds. studies were done when we wash our hands, it's about every 5 to 7 seconds. So we have to almost, add it about 3 more times. It does take longer, try to do it, but it's a must. That's a must thing that we must do. Wash your hands with soap and water at least 20 seconds. Of course, we need to cover a sneeze and cough. The best way is, especially this day and age, we used to say, you can elbow your cough, but no longer. You need to carry your tissue or napkin with you, and then once you use it, just dispose in the garbage bin. We need to wipe down the common touch surfaces. Of course, common stuff, your desk, your laptop, the doorknobs, elevator buttons, things that we touch commonly. So we need to make sure we wipe them multiple times. No handshaking. It is becoming very important. We must follow that. We can elbow if we absolutely have to, but no physical contact. This virus, as of now, is through droplet. That means through contact, it gets spread to one another. Next slide.